Hi, my name is Shannon Ward, and I'm here to talk to you about a mental health condition which is also known as an eating disorder. It is called Bulimia Nervosa, and I am going to be outlining pretty much everything that is listed in the DSM-5 for the criteria for it. So here we go. What is bulimia? Bulimia nervosa is a mental health disorder. It's also classified as an eating disorder where an individual will eat in excess, and in order not to gain weight, they will purge. In some instances, those with bulimia will fast for long periods of time, and then they will overeat. Something else that's very common in those who suffer from bulimia is overexercising, so that they burn off the calories and don't gain weight. Another thing that's common is a lot of those who have bulimia nervosa will use laxatives and abuse them, not just use them, but abuse them, along with purging to rid themselves of the food that they took in during their binging episodes. Who does this condition affect? Bulimia is known to occur in more women than men, and in the DSM, it does outline that it is more common in white women. It's also more common to find this eating disorder in young adults, especially those who are obsessive over their weight. Bulimia can have an effect on the well-being of an individual's personal or social lives, and the overall health of an individual. It's very common for someone with bulimia nervosa to run to the bathroom after they eat so that they can purge. And it's also very common for someone with bulimia to refrain from going to social events with their friends or family members where there's going to be a lot of food, especially if their family is aware that they have this condition, because their family is going to be watching over them very closely. So they do try to avoid that. Some symptoms of bulimia include overeating, the inability to stop eating, obsessing over body shape and weight, overexercising, vomiting after they eat, using laxatives in order to prevent the body from gaining weight, and from purging and vomiting, maybe enamel erosion, gum infections, and things of that sort. Some diagnostic criteria, some behaviors would be binge eating on a reoccurring basis. This means eating more food than others would in one meal or sitting. Sometimes an individual is unable to stop themselves from overeating. They also like to prevent weight gain in any way possible. So this meaning they run to the bathroom and vomit after they eat, they fast, they overexercise and use laxatives like I said before. There are episodes of binge eating and purging, and for someone to be diagnosed with bulimia, this has to occur at least once a week for 3 months or more. Like I stated before, the individual will become obsessive about their body weight and shape, and mental health professionals do need to make sure that bulimia is separately diagnosed from anorexia, because that is a different diagnosis that has a lot of similar characteristics. There is a severity scale. So mild anorexia or mild bulimia would be 1 to 3 episodes per week of overeating and then binging or purging. Moderate would be 4 to 7 episodes, and severe would be 8 to 13 episodes, and then extreme would be 14 plus. For comorbidity, some of those who are bulimic may suffer from other mental health disorders, and it's common for those who do suffer from bulimia to suffer from other mental health disorders, such as depression or anxiety. Another factor that I found is that substance abuse is common for those with bulimia. It's stated that about 70% of individuals suffering from bulimia abuse substances such as tobacco, diet supplements, and other medications. Suicide risk. It's pretty elevated in those who have this condition just because they don't see their true body in the mirror. They see some, I guess, fat person I don't understand it, obviously, because I don't have this condition, but they see someone fat when they probably are extremely skinny. And those who have bulimia should be definitely evaluated for risk of suicide, including previous suicide attempts. What is it like to live with bulimia? Some individuals who suffer from bulimia may find that they are bloated, constipated, have pain in their stomach, etc. Some women find that their hormones are affected, such as their menstrual periods stop or they just aren't consistent. Others may realize that they become aggravated easily, they're moody, and they're irritable just due to lack of proper nutrition. There's a lot of treatment, and it's definitely possible to recover from bulimia. Some of the treatments that I saw in the DSM were CBT, which is cognitive behavioral therapy, and that is just changing the patient's attitudes and beliefs about themselves. DBT, which is dialectical behavioral therapy, is using skills to change their behavior. And then psychodynamic psychotherapy is finding the root cause behind the problem. So really finding why this person views themselves in the way they do and helping them to solve that and overcome that. And that is it. Thank you.